This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hi, welcome to Rogers TV's special programming for Mental Health Week. I'm David Shearman, and for the next hour, we're going to be talking with a number of people who are in the mental health field about mental health and maybe some of the services that are available in Grey Bruce, as well as some of the things that we can talk about and we will talk about and maybe even need to talk about in terms of our mental health. Rogers TV is pleased to be a co-sponsor for CMHA's Mental Health Week, which runs from May 3rd to May 9th. And we have a number of guests with us today, beginning with Clark McFarlane, who is the Chief Executive Officer of Canadian Mental Health Association, Grey Bruce Mental Health and Addiction Services, which is a long title for Clark. Good to have you here, Clark.
Thank you.
We've also got Jackie Ralph, who is Youth Coordinator for CMHA Grey Bruce and Mental Health and Addiction Service. I'm just going to say CMHA going forward because that's a whole lot easier for me to say when I get to the titles. But Jackie is also no stranger to Rogers TV, and good to have you with us always, Jackie.
Thanks for having me.
We've got Matt Shute, who is Director of Housing Services for CMHA. And housing services are a really important question for everyone in Grey Bruce, but also especially for people who are on the edges, as people with mental health challenges often are. We've got Shannon Reinert, who is team lead for the Assertive Community Treatment Team and brief counselor for outpatient mental health services at Grey Bruce Health Services. And it's important to remember that CMHA may be one agency, but there are more than one agency. There is more than one agency a part of mental health here in Grey Bruce. And then finally, we've got Amy Bowens, who is manager of outpatient mental health services at Grey Bruce Health Services here in Owen Sound. So welcome to you all. And dare I say it, happy Mental Health Week? Is that okay?
Sure.
Okay.
Something to celebrate.
Absolutely. And Mental Health Week has got quite a history. Clark, how long have we had a Mental Health Week in Canada?
Oh, wow. This is 52? No. Go ahead, Jackie.
Jackie is giving you the cues, you know.
Yeah.
Yeah. I think, if I'm not mistaken, this goes back to, is it 1951?
That sounds about right. Yeah.
Makes it the 70th year. That's older than all of us. All of us who are sitting here on this show, we're all less than 70. But that's important because I think it shows how long the CMHA has kept mental health in front of the Canadian public. It continues to be a continuous and important issue. Now, one of the things that I think that we often forget is that mental health affects is part of every one of us, isn't it?
If we do
absolutely. Yeah. Mm-hmm. Go ahead, Jack.
I was just going to say, with the kids, we say if you have a brain and you have a heart, you have mental health because you have thoughts and you have feelings. So,
Very true. Very true. But the flip side of that is that sometimes we have mental health challenges. We may feel blue. We may feel down. We may feel excited. And is that normal?
Absolutely. Yeah. I mean, we also say that there's no health without mental health. So it's a critical component of our wellness. Mm-hmm. And need to make sure we take care of our mental health just as we take care of our physical health, as we exercise and ensure we stay physically fit, and we want to make sure we stay mentally fit as well and mentally healthy.
And one of the things that, particularly in this time of COVID-19, there's been perhaps an increased emphasis on mental health, maybe some awareness of mental health. What are some of the things that you find are helpful for people to do, Clark?
For people to do well, I think one of the things that we all find challenging during this time is that absence of connection. We've really felt that distancing, and so I think it's really important that we make efforts to stay connected in any way we can to those who we're closest to, and also to think of others who might be in danger of becoming isolated, who may not have extended family around, and to reach out in a safe way virtually to just say hi. It makes a big difference. If you can, we all need to be perceived. We all need to be seen and know that we matter. And just to pick up the phone and say hi and that you matter to me goes a long way.
I was one of the things I have discovered is that I deal a lot with the senior population, and what is happening there is that there is an increased connection where it's possible using the technology, the very technology we're using. Mm-hmm. And what happens is that grandma or grandpa will say, "I really miss you," and the teenager will say, "Hey, have you got a phone or a smartphone?" And then somebody will get them an iPad, and the teenager will say, "Look, I'll help you get on, and we'll have a conversation on Zoom or Skype or whatever conferencing system works." And it's really kind of exciting to see people who I honestly didn't think would be comfortable using technology saying, "Oh yeah, I can do that." Mm-hmm. And they're keeping connection. They're making those connections. I heard of one senior telling me that I had 25 members of my family on Zoom one Saturday. It was great. and so that connection for mental health is so incredibly important, and it's actually quite exciting. Quite exciting. And how I'm just going to say, how are you finding that people's mental health is generally? I mean, I'm looking for something that's kind of descriptive across Grey Bruce. Anyone?
I think one thing that we've seen, and a word that kind of describes it, is struggling. One of the things that I'm recognizing in our clients, in staff, in friends, in family, is all those natural outlets for connection, for physical health, going to playing on your volleyball team, meeting up for euchre with your buddies, all those natural ways of, as Clark said, connection, but also working on our physical health, that type of thing, aren't available. And there's a word really going around, I saw it on Facebook, and everything is languishing. That we're in this place right now where we're not feeling great, but feeling stuck and not really knowing how to move forward. I don't know if anybody else has any thoughts on that, but that's just what I'm seeing.
Yes, I think you're right. That word languishing has sort of popped up in the last couple of weeks, and actually I first read it in the New York Times. That is the word, and it's not an uncommon word. In fact, it's an old term that has been used to describe where we are and what we're feeling. And I tested it, and a lot of people say, "Yeah, that's it. That's exactly where I am." And I think it's a healthy thing to at least recognize it and to name it. And it's interesting that you would say that you are seeing increased effect in the population that certainly you serve at the hospital, Amy. I had a conversation with my own doctor because my doctor is doing treatment by telephone now. Don't see him anymore. So got to talk to him on the telephone. But he asked me, one of the very real questions he asked me is in my last conversation with him was, how are you coping? How are you doing in this COVID time? It's the first time he's asked it, actually. And I said to him, I'm doing okay. And that could lead into a whole other long train, but I don't want to take it there. But he came back with, I'm seeing about half of my patients doing okay and half of them not. Mm-hmm. And I thought, that's an interesting kind of summary of where we are right now in COVID. And I know it's not scientific; it's just one physician's remark. And I think it kind of jives with what you've been saying, Amy. And have you seen? GBHS is one of our primary, or is our primary inpatient treatment center. Are you seeing an uptick in admissions or severity, anything like that?
So one thing that we're seeing with every lockdown is that our number of admissions actually goes down a bit. People are not wanting to come to hospital. But then when a lockdown is lifted, the acuity is substantially higher. So all those people that kind of held off are now coming in, and then their acuity is considerably higher. And then just in general, and Shannon can probably speak to this a bit more from the brief counseling perspective, but from a case management perspective, the number of clients that we're seeing, the overall acuity is higher, and their level of coping is lower as well, just because making all those other connections to the community, they're not able to do that. Like those natural connections, those aren't available. So we're trying to figure out how to navigate and help them. Even just something simple as getting to the grocery store. Those day-to-day tasks are really hard now.
Shannon, are you seeing the same thing, increased, actually, let me ask it in another way. What kind of issues are you seeing?
Yeah, so we know just in a general sense that when our environment changes as humans, we tend to naturally react with anxiety and some fear. So this is a global environmental change with restrictions and lockdowns and so on. And also as a therapist, typically people that walk through my door are struggling with situations that happen within the home, and ways in which they've coped previously may be those social engagements and attachments to people outside of the home, which is certainly limited at this time. So, certainly some of the major concerns that arise when people are stuck within a home for prolonged periods of time, when kids aren't able to go to school and leave the home and socialize with peers and adult figures that are safe for them, or relationships that have struggled maybe with some trauma and abuse and so on. And what's interesting to me that I've noticed more is new mothers. So we know that having a newborn is a very overwhelming and sometimes challenging experience, lack of sleep and so on. And some of those Ontario Early Years centers that we are fortunate to have allow mothers to get out and connect with other new mothers, just for some relief, some venting, some support, some education. And that is certainly limited in that capacity now. And so the sense of isolation is immense for some individuals. And then just in terms of some of the work that I do with people that have histories of trauma, unfortunately, it's getting kind of reignited in terms of the fear and anxiety that gets triggered in a pandemic and what we're going through right now.
And often the not just the traditional community supports that might be available to new mothers are available are not available. Family supports are not available because of travel restrictions and the issue of bubbles. And it's a do you help your kids and be isolated yourself? And I know some parents who have found that to be a very real choice they've had to make. My daughter had a new baby. As a grandmother, I want to be there, but I can't, or I should, but I shouldn't. And it's a lot of tough choices that have to be made, isn't it?
Absolutely.
Yeah. One of the things I noticed actually very recently is that a study that has been done and released in the Lancet, the British medical publication, suggests that suicide rates actually have come down in 21 G20 countries. They looked at 20 high income, I guess, wealthy countries, and discovered that suicide rates, which is probably the extreme end of the scale, have actually declined in the first few months of COVID. Have any of you want to comment on whether you've seen any changes here?
I can't speak to any specific stats, but from our experience, I can't see our rates have declined in Grey Bruce. I don't know if CMHA wants to comment, but just from what, of the people that we know that we've lost to suicide, I can't see our rates have gone down.
I think it also depends, I agree, Amy, on the definition that particular study used within the Lancet. I had read the same thing, David, and so depending on the definition of suicide related to that study, not everybody would fit that definition, and then that tragic event wouldn't be captured within the numbers that they're taking a look at. So certainly when we are looking at people's resiliency over time, doing what we would think in terms of declining, and to use Amy's word from previous, languishing or tenuously coping, it's certainly, the longer this pandemic has continued, the more challenges it certainly presented.
You make a good point, Matt. But I think the other thing is that definitions aside, it also did not take into account things like opioid overdoses, which kind of cross the definition line between a medical overdose and something that may have been intentional. We just don't know, and that's a whole other conversation. And we've certainly had that here at Rogers with Ian Reich at Public Health, dealing with the opioid situation, which is another public health epidemic, as well as having an impact, I'm sure, on you as well as mental health workers.
Well, I think when we think about the communities that we serve and support, and the staff that we work with, and all of the stakeholders, we're all experiencing this. It's really two epidemics within a pandemic. So the housing and homelessness epidemic, the opioid epidemic, now in the context of Shannon referring to earlier as this global pandemic, that's where it gets really challenging to withhold that same degree of resiliency, and in some cases that same degree of hope, which is so critical to either being able to move forward or even message moving forward. It's a significant challenge, but I know that everybody on the call here today would be able to come up with example after example of people rising to that challenge, whether it be somebody we support or somebody that we work with. And even though these times have been exceptionally difficult, there's been some pretty wonderful stories of hope scattered throughout consistently, which is just tremendous and speaks to people's tremendous reserve.
Thank you for raising the kind of triple pandemic. You used double pandemic. I'm going to use triple pandemic to describe the situation we're in this mental health week, because we've got COVID, obviously, but we've also got opioids. And I remember Dr. Davila, before COVID hit, and this is probably over a year ago, Dr. Davila from the Toronto Public Health Unit saying that, why aren't we doing something? The opioid epidemic alone is like having 12 jumbo jets crash in a year. And if that was happening, we'd be all over it. But we're not dealing with the opioid epidemic really well. Plus, now we've got COVID, and you mentioned housing. And that is a very important issue, isn't it? And that's particularly where you work, Matt.
Yeah, I work in supportive housing with CMHA, and it's, I guess, again, just in the context of COVID-19, somebody is just as likely, 2.5 to 5 times greater to contract COVID-19 if they are homeless or experiencing an eviction versus living in safe, affordable, and secure housing. And one of the challenges that we have, not just locally, but provincially and then across the country, is a lack of affordable housing. And again, we've seen some really creative solutions. But if we put ourselves in that particular situation of not knowing where we were going to sleep at night, it's pretty difficult to work through the myriad of other things we may be experiencing when our primary focus really does need to be on where could I sleep that I'm safe and where can I get some dinner. It's one thing to work in that field. It's certainly another that to actually experience that.
Very much, very much. One of the things that I've noticed is that there are increased supports. It's not perfect, believe me, but there are increased supports that we hope will be around longer than just the pandemic made available. And I think of some of the things, for example, that OSHARE has done and worked with Safe and Sound here in Owen Sound, and the Meals to Rooms program, which has really helped a lot of people. And I'm sure that those are the people that you work with as well.
Yeah, I think getting food to folks who are in a hotel room by way of shelter, especially when some of the hotels are certainly not centered in Owen Sound. The efforts from both OSHARE and Safe and Sound and the Y and Moequanong to ensure that meals are getting out, and so that somebody's experience can be as healthy as possible. It also, and food has a tendency to do that, but it also ends up sort of being an offering, reminding somebody, hey, you're here, but you're not on your own, and we're thinking about you. And I think all of those organizations, in collaboration with both GBHS and CMHA, have just done a tremendous job at continually reaching out when the need is so glaringly there.
And I think it's probably fair to say that if someone who's watching this has a need, they just need to reach out. Where would be the primary place of contact that you would recommend if someone is watching this program and say, hey, this is not good, or recognizes that their situation isn't good, or they're either hungry, haven't got a place to stay? Where would they call? Anyone?
211. 211. I always tell people it's going to take me 45 minutes to tell you the 45 programs that we have, but with 211 you get the benefit of learning about the Y and OSHARE and United Way and CMHA and Great Bruce Health Service all in one phone call. And it truly is, that's the reason it started, and that's its job. And so it's always the best start. Sure.
And if someone is feeling really how shall I say, is really, or a family member notices that someone they know, or another family member is really spinning into crisis, what should they do?
There are a number of options that a person could do. At 854 2nd Ave, there is How Grey Bruce, and that's a partnership between CMHA, Bruce County, Grey County, and GBHS. And there is a mental health clinic there, so that people can just walk into, and there's somebody there Monday to Friday, 9 till 3. There's also housing support there. So there's lots of different ways to get connected to the larger system, starting from there. But if a person is in a serious mental health crisis, always go to the ER. There's always crisis workers that they can talk to, and that's the safest place to go to.
Very true. And that place you mentioned first, Amy, 854 2nd Ave East. That's kind of just down the street from City Hall.
Yep. Yeah, it is.
That's sometimes in Owen Sound we say, oh, that's a number. Where is it? Well, just down the street from City Hall.
Pretty much right beside City Hall, and the only building downtown that happens to be lime green.
Oh,
so it is easy to find in that regard. And certainly the staff do a tremendous job there of creating a welcoming environment to ensure that whatever they need, if you end up popping in there, somebody's going to be able to support you with what you need, even if it isn't there. But letting you know about other services, much akin to Jackie's comment about 211. There is also the mental health crisis line, which is 1-877-470-5200. And anybody can call that at any point in time if they're feeling as though they're undergoing a mental health crisis. Mm-hmm. Never a wrong reason to call.
Yeah, there's an old saying that I've heard many times called "no wrong door," and that's still true, and especially for mental health, isn't it? Doesn't matter where you walk in, you'll get some help, no matter where you go. Okay.
Agreed.
Yeah.
And the other thing that I wanted to draw out for people who are watching is that there is a huge increase in cooperation and partnership between mental health agencies here in Grey Bruce. I mean, the fact that we have people from CMHA, from GBHS, sitting at the same table. Well, a few years ago, that would have been a little more difficult, but hey, you're all serving the same clientele. And that's a really good thing. And so that people can be assured that we talk to each other, help you, because we know, for example, Matt knows, Shannon knows, Amy knows, Jackie knows, Clark, and hey, we can help. We can help. Now, Jackie, I want to focus a little bit on you because you deal with a very specific population, and that's young people. What are you seeing among youth here in Grey Bruce during this challenging time?
Yeah, I used to joke around that our busiest year we did 600 presentations, and when you look at the calendar and so many days of the year, how is that even possible? And so I never thought it would be possible to beat that number, but apparently with Zoom instead of driving, apparently it is. So yeah, we absolutely have been noticing our request to pop into a virtual classroom and speak to mental health, to speak to online safety is a real concern, because this, to be honest, is a perfect storm for things to go a little sideways. And so just making sure that we're talking about that. And at the same time, we do our best job to support those that are supporting our kids, because that's a really big part of it too. You can't have one without the other. And, there was a webinar this week that was all about when our adults in those spaces are feeling stressed, then that balloons down to the kids. So how do we make sure that both are getting what they need? But what's been really great, again, is just the fact that this conversation is coming up so much. So I will always be grateful for the increase in conversations and invites to speak to groups that we've never typically spoken to before. And I always cherish our relationships with, including our school boards, and having those opportunities.
How are your puppets doing?
So funny you asked that. Yeah, it's been very different to have the puppets this way instead of um, face to face with the kids. So it took a while to get used to it, but I really appreciated that. Since we came back from spring break, we've been doing our puppets remotely too, so that the kids see, hey, that puppet is not in the same house as the other puppet is right now, and that's been making a big difference. And but it's weird.
Well, somehow, Jackie, knowing you and knowing your puppets, I think it's probably a really big help to the kids to see that, hey, this crazy situation is okay. At least we can we can talk about those things. But it's good to hear that you and your puppets are still doing their outreach, telling their stories, and helping kids talk about this sometimes these difficult things. So good. Good. I know that teachers have also said to me, because I know a few, that this has been a huge challenge for them. I remember one teacher telling me that when they first started out on online teaching, the first thing she actually had to do was take the kids around her house. Because all of a sudden, this is weird. We're not used to tell. So what's your house like? You have a dog? And the kids were trying to normalize and make normal this very unreal situation. And once she did that, she actually discovered that the kids settled down. Her students actually settled down. Oh, yeah, sure. Sometimes she'll see someone turned upside down and hanging their head over the back of the chair. But yeah, these are very young grades. These kids are kids, I guess. So are you finding, Jackie, that you mentioned, or someone mentioned, online security, online awareness? Is that a major issue in this over the last year?
Well, again, it's everything is such an oxymoron. We have studies over and over and over again. Please limit screen time. Please limit access to phones at certain ages. At limit. Apps that we use, and then what do? We hey, for 8 hours a day, it's a free for all. So it is when it goes against what you've been trying to send the messages out. Hey, you need to be outside. Hey, you need to be moving around, and then everything changes, and you have to sit for so long. Yeah, it is definitely one of the highest requests we get. Hey, can you talk about online safety? Can you talk about relationships online? And it's almost it's refreshing to be able to talk about things at a younger age and get those mental health conversations going early, but it's also alarming how early we have to start having these conversations.
Well, I'm sure, and things like sexting that has been going on kind of in the background and has been an issue in high school. Is that coming to a forefront as well?
So it's again, when we think about the perfect storm, so it isn't. Yeah, it's definitely something that we're seeing again get younger and younger, and that's the part that's scary.
Yeah. Online safety is a huge issue, whether it's relationships or inappropriate pictures or whatever, or Zoom bombing. So I trust our producer will make sure that doesn't happen here. But those are the kinds of things that are important as part of mental health as well. One of the things that I also wondered is there has been some conversation about, we talked a bit about opioids, but increased use of antidepressants, which have been, for many people, a blessing. Are you seeing that as well? Is that something you're seeing at all?
From the hospital's perspective, we haven't really noticed a change in the prescribing of antidepressants that has been brought to my attention at all. But definitely increased requests for counseling supports, definitely. There has been coming from the different psychiatrists, and then family doctors as well.
That's interesting, because it sounds like what people are doing is instead of turning, at least in this small group, turning instead of turning to drugs, are turning to conversation, talk, which would be the natural extension of those community supports that were, those social relationships that we would have, which sounds like people have got some, are doing some of the right things to talk about our mental health issues and reaching out in the right ways. Are you aware of now, I haven't talked to my friend Francesca about this recently, but are any of you aware of increased calls to 211?
I don't know.
No?
I mean, a number of our services certainly have experienced an increased volume, and the managers do note that there's an increased urgency for service from the callers as well. So I think people are feeling things coming to a bit of a head.
Mm-hmm.
I think one of the things that that has been a real benefit to Zoom, as much as we may be all zoomed out, if we use Zoom as a verb, is that given our rural setting, with the use of Zoom, we're able to actually facilitate counseling a lot easier now, because there isn't, the travel, and, for people, say, living in Paisley or, in Rockland, it's a lot easier for them to connect via Zoom than try and get to their counselor face to face. And then also attending group therapy as well. That has helped, especially with our younger population in our first episode program. A lot of them don't have transportation. So now, and the younger population is quite comfortable with social media. So they love their CBT groups because they just pop on their phones and away they go. And they find that really helpful. And it facilitates that connection when they're in those groups. Mm-hmm. Shannon, I don't know if you want to talk about some of the groups and what the benefits were that you've seen.
Sure, yeah, I think speaking to that, absolutely, it's allowed us to serve a larger geographical area for those that do have barriers based on transportation, or, coming up to the hospital, there is a cost for parking that sometimes is prohibited for people to be able to access the services. So this has certainly, I think, allowed us to reach some individuals that may have otherwise not reached out for counseling. And yeah, absolutely, the groups that we run, cognitive behavior therapy, dialectical behavior therapy, EMDR for short, but it's basically a trauma-focused intervention through a therapy group. We've had really great participation and commitment from individuals because they're able to access it from the comfort of their own home in a safe environment for many. And those that can't, we've been able to work with them to facilitate accessing those services virtually from a safer environment. And so, yeah, I think just speaking to Amy's point, as much as it, especially as a clinician sitting in front of Zoom all day, and for anybody accessing services, it can be that drain. And it's also got some pros to it as well.
That's interesting, because I think that's the first time I've heard that comment about Zoom being used in a therapeutic relationship in this way. That's really helpful to hear. I was aware that some 12-step groups have moved entirely online and have basically moved away from a face-to-face encounter, which has its upsides and its downsides, and it'll probably shake out once COVID begins to die down, which hopefully will be sooner rather than later. But yeah, this is interesting. I think that your points are very well taken, and I think people should recognize that there are options. The fact that you may live in Williamsford or in Eugenia or Priceville isn't such a difficult thing these days, because those services can be offered to you. So we go back to what we said at the beginning: help's available. Mm-hmm. Help's available if you want it, if you choose to have it.
And,
We've actually
and
found we've actually found our no-show rate has decreased with the virtual visits as well. So people are more likely to come to their appointments virtually than in person.
That's a really interesting observation, Clark. And because I know that is always an issue in a therapeutic relationship, because people, for whatever reason, do not show. And I guess it also makes it a little easier in the middle of a Grey Bruce winter too.
It does, yeah.
So yeah.
There's also been some where it hasn't been transportation, but moreover technology as being the barrier in terms of there's a lot of individuals without access to cell phone with texting ability, let alone data. And Clark, you can more speak to this than I, but certainly CMHA Ontario and other companies have come forward to close that gap. And we've seen some tremendous benefit from people being able to access those resources. I don't know if you wanted to touch on that, but
yeah,
absolutely.
We did have the good fortune to work with CMHA Ontario and TELUS, and TELUS did donate a number of phones with some service packages attached. And then we were able to purchase some phones as well that we then were able to give out to clients to ensure that they could access service, because to Matt's point, it actually did decrease access for those who would have accessed otherwise just by walking in, and they had no technology. So it was very fortunate. Yeah.
I'm aware that the social services here in Grey County is also, it's part of a province-wide effort, is moving towards an online-centric access system. And there are ways away from that, but this certainly would help that situation. Although I've been told that they will meet the client where the client needs to be met, as opposed to making online access exclusive. It's a different model, but they are certainly encouraging that kind of access program. So it's good to hear. It's good to hear. It sounds like people are beginning to work together, realize that there are things we can all do. And hey, maybe I should recycle my phones. One thing I can do for sure. Yeah. Matt, how are you finding the housing issue? We know there's a problem with housing. Did you find a lot of people who were homeless this winter, or were the social programs relatively relatively good for at least this short term?
I think there's tremendous efforts on behalf of the YMCA and both municipalities who fund that homelessness response to increase services to the increasing number of people living without shelter that we saw over the course of the pandemic. So longer stays were available, providing greater chance at accessing support. But we're still seeing the number of people without shelter outpace the growing supports. Currently in Grey Bruce, we have 66 people living without any shelter whatsoever on a daily basis, and that's just the individuals who have come forward and sought service. That's it's a pretty high number, and it certainly speaks to the need to continue to work together with the municipalities and with health service providers and other social service providers to ensure that everybody's able to access that basic human right, which in this end is housing.
Very true. Very true. I think that if people are aware of the issue, they certainly want to help in any way. And people who find themselves in those homeless situations just need to know it's that 211 call. It's the beginning to connection. And I have dealt with a couple of marginalized situations even in the last week, where we were able to make things work, but there's still a lot of people in precarious situations out there. That's for sure. That's for sure. We're now moving into a time of, on one hand, fatigue, but on the other hand, I wonder if we're starting to see some hope. My wife, for example, has worked as a volunteer in some of the vaccination clinics that the health unit has been running. And one of the things that she has noted is that there is an overwhelming feeling of hope that is now kind of rising as people are getting their immunization for COVID. And the sense of relief has been almost palpable. And I'm wondering if that is going to be the kind of gradual change that we will see over the next few months, that as the shots roll out, and they're now talking about millions of doses arriving in the month of May, that whether we'll start to see a lifting. Do you think that's possible?
I do think that's possible. I think that's the vaccines, I think, have always sort of been that light at the end of the tunnel. I think there have also been cautions that as we move out of the pandemic, there will be, what had been called the fourth wave. So we have the healthcare workers and those who have been working extremely hard, and and also some ripple effects on people's mental health and the addiction. So although we will emerge from the pandemic, there will be sort of some aftershocks and that we will be dealing with as well, I think.
Now, Amy and Shan, you both work in the hospital system. How are the staff doing in terms of their mental health?
Yeah, so I mean, in particular, health and social care workers are at increased psychological or risk for psychological effects from this. So looking at, in particular, frontline nursing staff and doctors that are right at the bedside of some of the COVID patients, the ER staff and so on, and across the corporation. We've also had some staff redeployment occur. So people that are used to working in one area of the hospital, in particular mental health, that have been moved to now be staffing the ICU because of some medical experience that they hold previously. So that, obviously raises some anxieties and some changing in, again, environmental change and so on, which increases that risk for anxiety and fear and whatnot. So as a corporation, we've been able to, our mental health services have been able to offer some staff support. So we've had, again, Zoom, but Zoom support sessions that we've offered. We offer individual counseling support across our corporation to our staff. And also we have what we refer to as a critical incident stress debrief team for more larger discussions, especially when it comes to making some healthcare decisions that are really, really tough for people to make on a moral and ethical standpoint. So I think, the corporation, just speaking for GBHS, it's for those staff that are on the front lines dealing in particular with COVID and the effects of that. I think there's some exhaustion for sure.
Mm-hmm. Amy, any comment from you?
I was just gonna say people are tired. They're getting really tired. But you can almost feel like we know this is going to end. We just gotta get through it, because we know that there is light at the end of this. So although right now our COVID numbers are increasing at GVHS because we're getting a lot of transfers from the Toronto area, people are still pulling together. They're still working together, And what's been really interesting is, with the redeployments, as Shannon said, there is some anxiety, but at the same time, this is what I can do to help. And, I'm excited to be able to make a difference. Even if it's helping out so that my coworker in ICU can now get a break, so it's really heartwarming to see how much people are still, helping each other out, backing each other up, and really working together because they know that we will get through this.
Let me ask another question, which it's fair. What I was going to ask you is, you're all working in the field of mental health. One of the things that I have found is that people who work in mental health are very special. They're people who have a deep care and compassion for people, who you really want to do the best thing and help people in the best way possible. And you develop your professional skills to help people. And are you seeing an uptick in interest in your professions at all? Because, the need for mental health workers is not going to go away. It's going to continue. Are you seeing more? I'm hearing people say, hey, I'm interested in going into nursing, or I'm interested in maybe doing something more in another line of healthcare. Is that true in your professions as well?
I think so. I can just speak to, we get a lot of requests for students. And I think this is anecdotally, but noticed over the past year that it seems to have increased. So, anywhere from nursing students to mental health counselors to social workers and social service workers. So there's an interest that way for people to enter in and support and help in the best way that they can and learn the field.
Mm-hmm.
Yeah, that's what I was going to say too, that I thought during the pandemic, we'd have no students at all. And we actually had more students this year than we had the year before. And when we get emails and inquiries from the teachers, it is almost every single one was, well, this is a student I never thought would be interested in this field and is all of a sudden showing some interest in doing this kind of thing. And, to be honest, my favorite thing in the world is when somebody who was here as a high school student, 3 or 4 years later, you see an email come through from HR, so-and-so, we're happy to welcome them to CMHA. And I'm like, oh, that is so wonderful. That makes me so happy. So the running joke is I'm responsible for about 25% of the hires in some capacity. So that makes me feel good. They came here, they got to meet all the different, we took them to the hospital to hang out at 4-5. We took them down to how to interview some of the folks that work there so that they really get a taste of every piece of mental health in the community. And then, to be able to see them come back 3 or 4 years later, it's the best thing ever.
That's good to hear. And I see you're all smiling, and that's even better, because there's nothing, I know you all have a deep passion for your work. I've worked with and I know enough about you, most of you, that it's a passion you've got, because you're not doing this, you're doing this because it's rewarding. You love you have to love what you do to work in the field of mental health. But I'm pleased to hear that people are kind of saying, hey, that's something I'd like to do. And it can even be as how shall I say, well, I'll be honest with you, I'll tell a little brief story. I was absolutely gobsmacked this past week when someone from my past reached out to me, a mother, and just told me about her children and how they were doing. And she said, do you remember, and it was their youngest daughter. I said, yeah, I remember her. Do you know that she has actually gone back to school and is doing absolutely fabulous? She wants to work in addictions. And I thought to myself, now that is a turnaround, because this young lady, when I knew her, was not on a good path. And she obviously has conquered whatever demons she had. And she's decided, I can use what I learned in my experience to help others. And I'm going, that's good. That's very good. And it made me feel very good to know that. So I would say to anyone who is considering working in this field, it can be extremely rewarding. And the 5 of you are all testimony to that, because Clark, I'm not going to ask how long you've been working in the profession, but I'm sure it's
a few years.
It's not your first rodeo.
Yeah. And we view that lived experience as a strength as well. to bring that to the work is a real asset and a real strength. So we value that.
Sure. So if someone is watching this show and is interested in following up on a vocational about the vocation, just reach out to CMHA and you see the people in front of you. And Jackie does not get paid a recruiting bonus. I will tell you that. It's not in the budget, but I'm sure if anyone is interested, Jackie would be a great person to talk to. Mm-hmm. We've got about 3 minutes left. So I just wanted to ask each of you what your hope is for the next year. Clark, what's your hope for the next year?
The hope. Well, I think, mental health and addiction have really had quite a spotlight during the pandemic. And I do hope that as we come out of it, that is not forgotten, that people remember how important it is to care for each other and for their own mental health as well. And take those issues seriously so that we can make some real inroads. Yeah.
Great. Amy, your hope?
My hope for the next year, much like Clark, is that spotlight on mental health doesn't diminish, but also that the stigma of mental health, having so many people gone through this languishing, this struggle, that the stigma decreases and that it's embraced and it's part of you. Mental health is just another part.
Jackie, what's your hope?
So one of the other interviews we did for Rogers this week was having some youth jump in and talk about how it's affected them. And the one young man put it so well. It's so great to see mental health become a casual part of conversation now instead of an uncomfortable part of conversation. And I really, truly hope that stays.
Matt, what's your hope?
I think that since this pandemic began, it's been difficult for everyone, for a whole bunch of unique and individual ways. I think to work in this field, it does take people like Shannon and Amy and Clark and Jackie and myself and many, many, many others to create, I think, the vision that we're all aspiring toward. It takes a whole community. And so my hope is that the community realizes the strength it has within itself and continues to come together in really creative ways to become a supportive and inclusive place for everyone to experience. So that's my hope.
Shannon?
Yeah, I think sort of echoing what a lot has been said, but really just connection, increased connection. So I think it's been a global learning curve in terms of how do we connect when we can't, go out to our neighbor's home and that kind of thing. And so we've increased our repertoire of ability or variety of ways to connect with each other. And so I think hopefully as we move past this pandemic and we can reconnect physically and socially, we don't lose sight of just that whole idea that we're all in this together. We're all coming out of this together soon, hopefully, and we have even more ways of building connection with one another.
And on that hopeful note, I want to thank all of you for participating in this conversation today. And thank you, friends, for being a part of this Rogers TV Mental Health Week special presentation. I'm David Shearman. We'll talk again.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Every year, dozens of Canadians are killed or seriously injured because they take risks around railway tracks. Talk to your loved ones about rail safety. Visit stoptracktragedies.ca.
After a night out with your friends, not having a plan for a safe ride home can leave you in a bad spot. You could end up riding in a police car, an ambulance, or a hearse. These unplanned modes of transportation can be a costly choice and do not take you home. Your plan could include a designated driver, a taxi,